detailed examination on this patient. I'm going to start with the head. I'm going to do decap BTLS, deformities, contusions, abrasions, avulsions, burns, bruising, tenderness, and lacerations. I'm also going to palpate for tenderness, instability, and crepitus. Then a few elements I will look for will be asymmetry of the head and face, drainage, also vital signs behind the ears, and snooded and seamed facial and nasal hairs, and configurant evidence. A few medical devices I'll look for would be only the nasal gastric device. I'm going to go down to the neck, decap BTLS and PIC. A few elements I would find, or may find, would be track marks and tattoos, medical alert tag, jugular vein dissension, tracheal divention, accessory muscle usage, look for carotid pulse, and crepitus and stoma. Medical device I would find here will be a tracheometry and a central venous catheter. I would go down to the chest, decap BTLS and PIC. I would look for paradoxal movement, accessory muscle usage, sucking chest wound, and crepitus. I would also tape, and medical device I would find would be pacemaker, internal cardiac complex, and a chest tube. Then I'll go back down to the dominant. Decap BTLS. I would only check for tenderness. A few elements I would may find will be distension, rigidity, guarding, any pulsating masses. I would look for signs of pregnancies and/or complications. I would also take medical devices I may find would be a gastrectomy tube, colonoscopy, and a medicine pump. Then I would go down to the pelvis, decap BTLS, and then PIC. I would check for femoral pulse, incontinuance, peritoneum, and signs of pregnancy and/or complications. I would check for vaginal bleeding, and I would only find a urinary catheter down here. Then I'm going to go down to the leg, decap BTLS, and also TIC. I would look for track marks and tattoos. Then I would check for pulse. And sensation, motor function as well. Push up. And push down. And what's going on here? The fat one. Okay. I would only find an IV catheter down here. Then I'm going to go up to the upper extremities. I will look for decap BTLS and TIC. Also medical alert tags. I will look for pulse, and radial and brachial. Then I'm going to check for motor movement with my hands, and function, and sensation. Which finger am I touching? Okay, I would find an IV catheter and arterial venous shunt and fista. Then I'm going to check her back, decap BTLS and TIC. Additional assessment. I will look for would be tattoos under underneath her shirt, a brachial radial pulse since I moved her, crepitus, and ischemia, edema, which I would find. And that would be all. Also on